Hello everyone, welcome to CAPSA. Today's topic is stages of general anesthesia. So what is general anesthesia? Anesthesia is a medical procedure where patients undergo painless surgery or other diagnostic tests. What are the types? Local anesthesia, regional anesthesia, general anesthesia. So what is general anesthesia? An anesthetic procedure where drugs are used to produce a state of unconsciousness with analgesia, hypnosis, and muscle relaxation to the whole body. Now we need to understand what do you mean by local anesthesia. So local anesthesia means when the anesthetic procedure performed in the small area of the body known as local anesthesia. Regional means when the anesthetic procedure performed to a large part of the body known as regional anesthesia. Which type of part? Like arms, hands, legs, etc. Okay. Now, what is Guedel classification? First, Dr. Guedel Arthur created a chart with an increasing depth of anesthesia ranging from 1 to 4, which is known as Guedel classification or stages of anesthesia. Stages are like stage 1, stage 2, stage 3 and 4. And stage 3 is again subdivided into 4 parts like plane 1, plane 2, 3 and 4. Now what is stage 1 or stage of analgesia or disorientation? It is a preoperative stage where after induced by medication, patients start to feel its effects without losing consciousness. Slowly patient becomes sedated and enters a state of analgesia. This state ends with loss of consciousness and amnesia. At this stage, breathing is regular but slow. Okay? Now we need to known with the term like analgesia and amnesia. Okay. So what do you mean by analgesia? Analgesia means feeling inability of feeling pain. Okay. And amnesia means memory loss. Okay. Now what is stage 2 or stage of delirium or excitement? It is a stage of unconsciousness and ends with the disappearance of the eyelid reflex. Okay. Irregular respiration continues with a dilated pupil but shows a reflex to the light. Because vomiting can occur at the end of this stage, so anesthetic concentration rapidly increases to pass quickly through this stage. Now we need to be clear about what is delirium. Delirium actually nothing, just a mental state where a patient feels confusion. Okay. Now what is stage 3 or stage of surgical anesthesia? At this stage, autonomic breathing starts and ends with the cessation of the respiration. Most of the surgeries are performed at this stage. For the estimation of accuracy level, this stage is subdivided into 4 parts. Plane 1, eyelid reflex still present with regular respiration. In plane 2, eyeballs movement abolished. Intercostal muscle activity decreases. In plane 3, intercostal muscle activity completely stops and reduced respiration occurs followed by shorter inspiration. In plane 4, diaphragmatic activity and respiratory exchange are reduced and pupil and eyelid reflexes stop. Now what is stage 4? Stage of overdose. This stage occurs due to the overdose of anesthetic medication, results in worsening medullary depression, starts with cessation of respiration and ends with the death. So the main anesthetic goal is to transition the patient quickly to the stage 3 during the surgery. What is happened during medullary depression? Medulla is linked to the cardiovascular system, respiratory system, and autonomic system. So what will happen? This all the main part of the body will be paralyzed. Okay, that results from the medullary depression, which leads to the death. Okay, if you need a original chart of Guedel classification, I have attached the link of the image in the description box. You can go through the image. Because of the copyright, I can't take the screenshot, or I can't attach this the copy with this video. So you can go through it. Okay. Thank you for your attention.